I can give you a specific example, but before that, let me just give you, I don't miss an opportunity to highlight why patient safety is important. You know, unfortunately, for a very long time, we realized that preventable harm is becoming a global challenge. You know, I can give you examples from different countries. In the United States, you know, the third leading cause of death is medical errors after heart disease and cancer. In Canada, the third leading cause of death is medical errors and preventable harm after heart disease and cancer. In low middle income countries, you know, combined, every year 2.6 million people die from preventable harm. And death is the tip of the iceberg. There is a lot of harm that is not, you know, doesn't reach to the point of death, but it's you know, it constitutes a lot of suffering, both physical and psychological. And there's a big also economic component to it. Actually, in 2020, when Saudi Arabia had the G20 presidency, I was honored to actually be part of the team that led the efforts of putting patient safety in the G20 agenda for the first time. And we commissioned a study by a report by the OECD, and it came out showing that 13% of the health expenditure is wasted on you know, on preventable harm. So think about this, the total health expenditure globally is 10 trillion. So 130 billion of that is actually wasted on preventable harm, even though that the investment in prevention is much cheaper than, you know, actually dealing with you know, and with harm afterwards. Now, I'll give you an example that can connect, you know, genomics, AI, and patient safety all together. Pharmacogenomics. So what is pharmacogenomics? Pharmacogenomics is when I know my genetic makeup, then I can understand what medications work for me and what medications don't work for me. Give you, you know, I take statins, which is for, you know, just fixing and controlling high cholesterol. You can do what's the genetic testing, so the pharmacogenomics, to figure out if they are actually good for you, if you are if at the genetic level you have the enough proteins. There's without getting very technical, you know, there's a group of enzymes that metabolize the medications, and if you are a poor metabolizer in one of those, if you have low enzymes and you consider, you know, a poor metabolizer of this drug or that drug, then that drug doesn't work for you. And when you look at so that's one part. If the drug doesn't work for me, if I'm taking something, you know, let's say someone had a coronary artery stent, and he or she is on a medication that prevents blood clotting of the stent. If that medication doesn't work, they could actually end up dying. You know, this is how serious it is. And before pharmacogenomics, you know, there was no way of us figuring this out. But it goes beyond efficacy to also the side effects profile. So let's say, okay, these two medications work for me, but then one of them has a high risk profile and the other has a low risk profile. Before, and I think this continues for very long, you know, for many, you know, practitioners and physicians, we just go by, you know, trial and error. You have a high blood pressure, you know, you try this, and and I think in 2024, you know, moving almost towards 2025, I think we can do better than you know, kind of the trial and error. One other thing that we have in medicine is what's called the adverse drug reactions. And basically the adverse drug reactions can be, you know, I'm going to stick my neck out here and say that adverse drug reactions can be eliminated if we really, you know, expand the implementation of pharmacogenomics. Because if I knew, you know, from the get-go that this medication doesn't work for me, I'm not going to take it. And there are actually some medical insurance companies now for certain drugs do not pay for the drug if the pharmacogenomic testing was not done. So yeah, so that's the kind of the connection, you know, of these different issues together.